Why did you agree to it?
Well, I think the first reaction is this really something that we want to do? Do we really want to, have a reality show where our and our patients' every movement and every thought are being chronicled? And after doing a quick assessment of why not, it quickly switched to, of course, this is something that makes a tremendous amount of sense, because there's an incredible amount of mystique about cancer and cancer treatment. And I think what I've learned in many years of being an oncologist is people's perception is always much worse than what the reality is. And so if we could allow the cameras inside to follow patients and their journey, it would certainly go a long way to breaking down some of the myths that people have about what cancer treatment is like and what it's like to go through the medical system, the daunting and scary aspects of the medical system. Put human faces on it. And once we got to that point, it became a no-brainer that this was really something that we should do.
So what do you think peeling back that curtain then and being able to see behind it allows the people out there, the viewers, to be able to see?
It allows the viewers to be able to see the human face. That when you get cancer, you're not treated by chemotherapy and you're not treated by radiation therapy or by surgery. You're treated by people who practice medicine and who utilize those things as the tools in helping to cure your cancer. So it takes it away from being this abstract series of frightening terms and turns it into really an interaction between human beings.
How is that for you? You just mentioned to be able to see the people, to be able to see the kind of the human emotion behind it all. Your life has been about treating medically the disease. How is it for you to watch all of that human emotion unfold and these lives be changed?
Well, it's interesting to watch it as an observer when I've seen some of the scenes from the Dallas Hope production, as opposed to being in the middle of it when you're dealing with patients personally. When you're in the middle of it dealing with patients personally, it's a much more moment-to-moment kind of an instinctive type of thing. When you can step back and look at it and put on an intellectual perspective, it's very interesting to see how, to see kind of it from the outside, seeing both our physicians, other members of the caregiver team, our nurses, our navigators, our social workers, our chaplains, having that interaction with the patient and the patient's response to them. I think this not only will be illustrative to patients and to the public in general, it'll also be helpful to us as caregivers, as part of the healthcare team, to really have this perspective where we can step back 10 feet from the scene and really look at both the reaction on the caregiver's face and the patient's face and their family member's face at the same time. And it will give a new perspective to the things we do every day.
Watching it as opposed to going through it, did you learn anything by watching it? Did you see anything through it?
Well, again, I think clearly when you're going through it, you may be focused on one person in the room or one aspect of it and get that direct feedback. But from watching it, again, this is not 50,000 feet, this is 10 feet. Watching it from 10 feet back, you can see the interaction, the interplay, the faces of all those involved. The patient, their family member, and other members of our healthcare team. But even more importantly, the thing that we as as healthcare providers, as physicians and our nurses, et cetera, never get to see is what happens when that patient goes home, and the discussions that they have with their family members, with their children, with their friends. And now that curtain has been peeled back for us as well, and we can see how what we did that morning relates to what happens that evening when the patient is back at home. Did they hear the same thing that we said or that our colleagues said, in that when they're going home and they're digesting some very daunting news and complicated information? And this will help us in the future in how we explain things and how we discuss things with patients and their families.
Chances are, if you don't have cancer, you know somebody in your family that has cancer, you have a friend that has cancer, and statistics show that more and more people are getting cancer, but it also shows that more and more people are surviving from cancer. And just in the last few years, Baylor spent $350 million on the new facility. And what do you think Baylor is offering this community here in North Texas in regards to cancer care than it didn't have just 2 years ago?
Well, what we're offering that we didn't have 2 years ago are certainly much improved facilities and surroundings. The way we go about things are still the way they've been done at Baylor for a long time, where the patient is truly at the center of things. But now with the expanded and enhanced facilities, we can do more of that. We can expand our patient navigation services, which are very important to the patient and their family as they go through the complex journey of cancer care. And again, just like this show will do, helps to demystify all the things about cancer care. We're able to have more facilities for those many survivors that you mentioned, 12 to 14 million cancer survivors in the United States right now, in terms of things like our nutrition demonstration kitchen, because you want to learn how to prepare your food in a healthy manner when you're a cancer survivor to improve your overall well-being and perhaps to decrease your chance of your cancer going back. The facilities for physical exercise for our patients, because exercise is an important part of regaining your strength and returning to your normal life, the life you had before the word cancer became part of your life. So we can do a lot more of the things that we've always done, and we can do them in beautiful surroundings. And certainly when you're going through all of these things, having the comfort of art on the walls and airy, open, well-lit spaces makes it maybe a little tiny bit easier to go through this perilous journey. Well, certainly, things like genetic testing, we're learning more and more every day about the fact that there are genetic risks to certain cancers. Mm-hmm. We know that in breast cancer and ovarian cancer, there are two particular genes, and if those genes are in your family, your chances of having those cancers is much greater. We know in colon cancer, we know a whole lot about the genetics and the families of colon cancer risk. And every day we're learning that there may be more cancers that have genetic risks. And then when we know those things, we have to find the best way to treat them. And over the decades that we've been fighting this war on cancer, a large portion of our weapons were determined through the use of clinical trials. Yes, more and more patients are surviving cancer every year, but there are still those who are not surviving cancer every year, and it's because we still haven't gotten all the tools we need to provide everybody with the best chance of cure. So through clinical trials, we offer newer treatments. We offer better ways of treating the cancer today and tomorrow than the way we treated it yesterday. So it's very important to try and have a variety of cancer clinical trials available to patients so that there are more options for them. And here we usually have in excess of 100 cancer clinical trials open at any time, divided into the different types of cancer, breast cancer and lung cancer and leukemias and the others. And each year, within the Baylor Health Care System, over 1,000 patients participate in these cancer clinical trials so that we can improve what we do for those individuals, but more importantly, what we do for the individuals who come down with cancer in the future.
And watching these 3 patients' journey, what do you think people will be left with when they get done watching their journey?
Hope they'll be left with a new sense of hope, a sense that if I get cancer, it is not necessarily the end of everything for me. I'll have a fight ahead of me, and I've got a good chance with a lot of people supporting me of winning that fight, and then I can return to fulfilling the hopes and dreams that I had before somebody told me I had this diagnosis.